Hello and welcome. I'm Dr. Liana Lianov, and this is the Lifestyle Medicine podcast series for the RCSI University of Medicine and Health Sciences. And today's topic is healthy aging, and I'm delighted to have with us Dr. Susan Friedman, who's a professor of medicine at the University of Rochester, a geriatrician, and a lifestyle medicine physician. And her focus lately has been on using lifestyle medicine for healthy aging. So welcome, Susan.
Thank you so much for the opportunity.
Glad to have you. And let's dive in. And one of the natural questions that comes up is, what is the difference between biological aging, our actual age since we were born, versus and how it compares with our chronological age? I got that reversed. So biological is our body, and the chronological is since the time we were born. But they are different, right? So tell us a little bit more about that.
Yeah, certainly. So, yeah, I think that question is really born out of the observation that if you look around at older adults, you see, just sort of an incredible heterogeneity, right? In geriatrics, we have a saying that if you've seen one older adult, you've seen one older adult. And so, on the one hand, you have, if you look at a group of 80-year-olds, on the one hand, you might have some that are going to the gym every day and even running marathons. I think of Faja Singh, who didn't start running until his late 80s, and at the age of 100 became the oldest person to ever run a marathon. You see other 80-year-olds who are running countries. You see, I just got back from a talk by Judy Collins, who at the age of 84 can tell a fantastic story and still sing and just so beautifully. So, that's on the one side. And then you have older adults at age 80 who have significant cognitive impairment or, have difficulty with getting from place to place. So, and everything in between. And so, again, I think there is this spectrum, and that is related to this idea of biological aging. And there's a lot of, I think, work being done in this area, because we don't at this point have a really like a gold standard for measuring biological aging. There are people who are working on this at a cellular level, so looking at things like, not to get too far into the weeds, but telomere length. So these are the little pieces at the end of chromosomes that shorten as we get older. They're looking at other genetic, changes in our genes and chromosomes as we get older. From a more clinical standpoint, as a geriatrician, I can do measures like there's something called the Get Up and Go test that looks at people getting out of a chair and walking 10 feet and turning around and seeing how much time that takes. And depending on how much time it takes, it's very predictive of how long a person will live, what their care needs are going to be. Other things like grip strength has been shown to be a pretty good predictor of how people do in the longer term. So we know that again, there's sort of this big spectrum in terms of how we age.
We all start out with the same set of factors when we're born, but there is also genetics, which plays into it. But at that time, ideally, a newborn baby is similar to other newborn babies in terms of what it is physically, biologically, and then it's what we do over time to our bodies and how we live that can really impact then that biologic aging that you've been describing. And the more years that go by, there's more of a divergence. And so that's what you've described. Some 80-year-olds that seem quite youthful and other 80-year-olds that really look like they're just ready to drop. And why is that? So tell us a little more about how lifestyle affects this aging process.
Yeah, yeah. It really is kind of amazing how much of a difference it makes, right? It makes a difference both in terms of quantity, but especially in terms of quality of life, I think. We used to think, oh, it's all in my genes, right? My mother had diabetes, her mother had diabetes, so I'm going to get diabetes. And I think as the research has evolved, we've realized that really it's only about 20% that is really due to genes. And it's variable in terms of different diseases. There are certainly some diseases that are much more strongly associated with genetics. But when we think of the things that impact us as a society the most, things like heart disease, like cancer, like diabetes, high blood pressure, high cholesterol, all of those, those are very much impacted by lifestyle. And the thought is that about 70 to 80% of our chronic disease could really be eliminated if we were able to really optimally address what we call the pillars of lifestyle medicine. So, the food that we eat, exercise and physical activity, getting a good night's sleep, managing our stress, being social and connecting with others and avoiding things like tobacco and excess alcohol and things like that. So yeah, it really does make a big difference. There's a saying in lifestyle medicine that your parents hand you the genes and your parents hand you the clay and you mold the statue. So there is this interplay between our genetic predisposition, and I think there are diseases that run in families, but how those express themselves and when they express themselves really can be profoundly impacted by lifestyle.
Yes, and you mentioned that the whole cadre of the main elements of a healthy lifestyle. I'm curious what the science shows are the best of these pillars, or the most important healthy lifestyles to help us with healthy aging. I know they're all important, but is there one or two? Are there one or two that are even really standing out as the most important?
Yeah, so I guess I use the blue zone framework. Blue zones are areas where people live for long periods of time in good health. So they live longer, but they live with fewer chronic illnesses. And they've come up with 9 different components of these blue zones. I really boil those 9 down into what I call a 3-legged stool. So it's physical activity, it's nutrition, and it's what I call connectedness. So all of those social components, and there's many pieces to that. So I think part of it is our relationships with other people, but also I think oftentimes having a sense of meaning and purpose is really key. Feeling valued, those kind of things. I would say would be my big 3.
Okay, all right. So what we eat, how active we are, and and hanging out with friends and people where we have positive interactions. And as a positive psychology advocate, yeah, that relationship piece is actually the heart of all of the positive psychology elements. So I definitely wave that social connection flag. And yeah.
Yeah, it's so critical. I mean, I think that the pandemic really brought that home to us. And I think, when we think about frail older adults and just sort of the barriers to connection and communication that happened in the setting of the pandemic, it really really brought that home, just how important that, I mean, we're social creatures, right? We need each other. So
Yeah. And
yeah.
it's important throughout our lives, but it seems like perhaps as we age might be even more important. And then things like activities that are meaningful, that eudaimonia, we call in positive psychology, seems to have some impact on the aging process, and it helps to lower the pace at which people become disabled as they age, is my understanding as well. Yeah.
Mhm. Yeah.
And so we've been talking about these pillars of lifestyle medicine and healthy aging. We also know that they're a challenge to to integrate into our lives, especially if we're busy and we've got a lot going on, or we mean well, we know what to do. It just doesn't quite translate into our day-to-day lives. So are there practical tips and tools that you would recommend, and particularly as we age and in older age groups, that help them really maintain these kinds of healthy lifestyles?
Yeah. Really good question. And I think that's the tough stuff, right? Because I think we all know that we should eat healthier and that we should exercise, but really sort of incorporating that into how we live our day-to-day lives, can certainly be challenging, and sort of making that shift. I think part of it is just sort of forgiving yourself for where you are right now, and not trying to if you're used to sitting on the couch all day, like not expecting that you're going to be running a 5K race in a month. And what I tell my patients often is you actually get the most benefit from going from nothing to something. You get much more benefit there than you do from going from high levels to an even higher level. And so just if you can get started, it's more important to be consistent than it is to take big steps. So, even exercise, going for a walk for a minute or 5 minutes, depending on what a person's functional capacity is. As long as you do it consistently, you begin to sort of perceive yourself then as, I am a person who walks every day. And so that may be, as I said, just that you're walking for a minute every day, but you're a person who walks every day. And so bit by bit, you then have a platform to build on, I think. So that I would say is one thing. I think the other thing is building a community. Again, getting back to this blue zone phenomenon. The people who live in blue zones, they're not trying to be healthy. They're not trying to live a long time. They just are, because the people that they're living with are doing the same kind of healthy habits that they are. So if you have some friends who are, really healthy, spend some more time with them, I would say. Or grab a friend and say, okay, I'm going to try to do this, and how can we reinforce each other? So I didn't mean to keep going on about blue zones, but they have these concepts called MOIs, which are communities that people are introduced to at a very young age. It's concept in Okinawa, Japan. And at age 4 or 5, people are introduced to their moai and they travel through life with each other. And so bit by bit, they help to reinforce each other's different health behaviors, as well as, I think the social connection is, again, a big piece of that. So I think those are kind of the main things that I would think about.
Okay, well, that's great. We've covered a lot of ground, although obviously this is a very complex topic. There's so much more to talk about, but at least we've hit on the highlights. Out of everything we've hit on, or maybe something we haven't hit on, is there a key message that you'd like our listeners to take away about healthy aging?
Yeah, thank you for that question. I think, one thing that I say to my patients, and I think it is well borne out by the literature, is that it's never too early, but it's almost never too late to start adopting healthy habits. I mean, they've done studies in patients. There was a great study looking at physical activity in a nursing home population that was done in the late 80s. And what they showed was that people were able to get stronger, but not only that, their quality of life improved to the point where they were moving more and they were basically reversing a frailty cycle. So one of the things that we worry about as people get older is that they lose muscle mass and become more frail, but they were actually able to reverse that process. And so these were people on average in their late 80s. And there's multiple studies that support that idea. So again, yeah, I would say start where you are and keep going.
That sounds very hopeful and a wonderful, hopeful way to end this brief podcast. Anything else to add before we end?
No, I don't. Not. I don't think so. But
Thank you so much, yes, for joining us, Dr. Susan Friedman. And thank you to our listeners to this Lifestyle Medicine podcast series. We hope to see you on another one of these. In the meantime, be well. Take care, everybody. Bye-bye.